first pasukan that I served officially was in the commando regiment.
Masa berkhidmat sebagai doktor untuk pasukan komando ni, the training, the conditioning untuk persiapan mereka pun semua atas tanggungjawab you. So that means all the physical fitness, health, semua bawah.
Betul. Doktor tak doktor, you ikut sekali.
Ada tak you pun kena buat training
buat. We used to pikul the boat semua, you know. We used to go out into the sea.
Sebanyak mana kita lihat pada kesihatan fizikal, kesihatan minda pun sangat-sangat penting. The mental health, the brain function, kesihatan otak, salah satu benda yang kita tak boleh pandang enteng langsung, because kita kena faham kesinambungan minda dengan badan ialah satu. So kita kena jadi komando juga dalam bab ni. Physical strength pun penting, mental strength pun sangat penting dalam situasi mengharungi dunia dengan masa-masa yang cukup genting ni.
Medical field ni pancreatic cancer.
Bersama saya Dr Roland Victor.
Satu benda yang one of the worst stress can happen bila you makan tak sedap.
Doktor, saya punya culture kena makan nasi.
Zaman moden.
But at every second of your life you either earn or learn.
Batu Medic Show. Okay, what's up everyone? Selamat datang ke episod baru Lesung Batu Medic Show bersama saya Dr Roland Victor. Dan today, biasanya kita dengar kita jemput doktor-doktor ataupun orang-orang perubatan daripada hospital, klinik dan sebagainya. Tapi hari ni saya nak jemput doktor yang berkhidmat sebagai pasukan keselamatan, sebagai doktor tentera. Okay, medical doctor dalam AMI. So bersama saya hari ni ialah Major Bersara Dr Amit J Logan. Selamat datang ke Lesung Batu Medic Show.
Terima kasih Dr. Roland.
Okay, so kita ni nak terkeluarkan senjata mana pula hari ni terus. Okay, so doktor pernah berkhidmat sebagai pegawai perubatan dalam ATM lah, Angkatan Tentera Malaysia. So macam mana doktor menjadi doktor and teringin sangat nak masuk dalam alam ketenteraan?
Okay, sebenarnya cerita dia daripada zaman sekolah lagi lah. Actually I was about 5-6 years old. So masa tu memang I ada minat untuk heal people. Okay, suka tolong orang lah kan. Nenek datuk semua sakit kan, so I'll go and cari some herbs kat kampung kan, tumbuk-tumbuk letak.
Ada lesung tak?
Yes, macam ni. Yes. Ada juga. So it brings back memories lah. So I like healing people. Okay. So that was one part of me. Another part of me, saya suka uniform. Bila saya tengok polis ataupun tentera ataupun security guard, masa tu tak tahu lah kan, I used to tabik, you know, salute mereka. So I love the uniform a lot. So I was very passionate about it lah. So di universiti saya mohon untuk beasiswa tentera lah. Okay, ATM. So masa tu I think 4,000 orang apply untuk scholarship tersebut. Okay, but yang ditapis adalah 400 orang. Yang dipanggil untuk interview 80, dan yang dapat 8 orang sahaja. Wow. My time lah. So I was a bit lucky lah. So selepas pada tu, so that was not a guarantee yet. Walaupun saya dapat beasiswa masa tu, there was no guarantee that I would be in the service. So selepas tamat medical school, we came back and perlu pergi pula untuk physical training, assessments, temuduga lagi, beberapa siri temuduga, barulah ditauliahkan sebagai seorang kapten masa tu. So my journey began there. And the first pasukan that I served officially was in the commando regiment, GGK. Okay. Masa saya dulu tu, I was directly attached to 22 Komando. Okay. So I'm very proud of that. You know, that opportunity. I was with 22 Komando for about 4 years. And semualah kita buat sekali. You know?
So masa berkhidmat sebagai doktor untuk pasukan komando ni, wow, I'm so excited already. The training, the conditioning untuk persiapan mereka pun semua atas tanggungjawab you. So that means all the physical fitness, health, semua bawah.
Betul. Wow. So what was interesting masa tu, doktor tak doktor, you ikut sekali.
Ada tak you pun kena buat training?
Buat. We used to pikul the boat semua, you know. We used to go out into the sea. What was interesting is every day was different. Satu hari you are jumping out of a plane, of a helicopter. Next minute you're diving. You are doing tactical training, and tactical medicine. So it was a fun experience. A lot that I learned during that time. So selepas unit commando, I was in Air Force, Royal Malaysian Air Force.
TUDM lah.
TUDM. So banyak pengalaman saya di sana juga, okay, especially with the KL base move to Sendayan. So I'm proud of that. Sendayan was my baby, so it's interesting to see how it has grown.
Faham.
Yep.
So berdasarkan, saya faham doktor pun lebih kurang macam kita dua pernah belajar di luar negeri.
Yep.
Saya di Rusia, doktor di Ukraine. Tak jauh masa itu mereka masih bersahabat. So ada tak that pengalaman belajar di luar negeri dalam situation like very hostile also, keras, a lot of environment, also membantu untuk make up the confidence macam nak handle golongan tentera elite macam komando and everything. Do you think that thing carried a lot of weight?
Oh, definitely. Apa yang the benefit that kita dapat bila kita belajar di negara seperti Rusia or Ukraine masa tu, is I think the ability to think on our feet. Kan kita selalu
survival mode.
So we don't have much options. Apa yang basic necessities yang kita ada dekat situ, we have to make it work. So it's very similar in the field as well. You cannot expect air conditioned rooms ke all this fancy gadgets or whatever. We just have to make do apa yang kita ada and provide the right treatment or care in this sense.
Betul. I just want to add that. Do you just record me satu syllabus yang I think mungkin you learned, I learned too. Dalam perubatan mungkin di luar negeri seperti Rusia, Ukraine semua, kita ada satu subjek nama dia military medicine.
Yes.
And mungkin ramai orang yang who are studying here ataupun negara-negara yang tak ada macam bercorakan ketenteraan macam disaster thing, dia tak ada subjek ni.
Betul.
So in that subject banyak benda yang saya belajar, like okay, dalam situation hostile, apa yang nak buat sebagai doktor? Okay. You tak ada equipment ultrasound yang canggih.
Betul.
You mungkin tak ada perkakas, but you need to think in the combat zone.
Exactly. So you need to really think on your feet, and the most importantly, you have to move to safety first. That is number one. Move to safety. Don't try to be a hero. That is the rule.
Betul.
Right. So we have in a tactical situation, kita ada banyak maneuvers yang kita boleh buat, okay, untuk membantu pesakit ataupun the mangsa yang cedera masa tu. So we have a very interesting subject called TC3, Tactical Combat Casualty Care. So yang subjek ni dia mengajar tentera, not only the medics but in general tentera, untuk macam mana kita nak to treat, to eliminate the threat, and also to retreat, to move to a safer place. So this is a very interesting subject lah. So, and I think it's very applicable in daily life juga lah. So it's not only in the field but in real life too. So sometimes we do have a lot of protocols involved, tapi masa tu in that kind of situation you don't have time to think, but you have to do just the basics, simple maneuvers, and we get them out to safety.
Scoop lah.
Yeah.
So itu yang di bahagian training. Dalam situasi harian, doktor pernah tak berkhidmat di mana-mana peacekeeping mission ke ataupun operasi di luar negara under
pernah. So my last mission was actually in Bangladesh. So that was
Cox's Bazar.
Yes. So we set up a field hospital masa tu. So kita punya field hospital yang paling sibuk di sana. Okay.
Kita punya mungkin yang paling canggih juga.
Kita punya paling canggih and kita punya yang paling I would say well equipped. The doctors were well trained, well mannered, and we used to see lots of people. One day sehari boleh sampai 200-300 orang. in such a small place. So ada negara lain yang dirikan dia punya hospital Medan di sana juga, but then yang paling sibuk kita punya.
Tapi like dari segi tugas doktor, in a situation like your expertise go into like more of tactical situation, like combat situation.
Yep.
How what is your role in that situation? Like do you have to look into the safety or?
So it's interesting. yang injury yang kita dapat di sana was not so much of, yes, we did get some gunshot wounds and those kind of injuries, traumas. But then we used to get a lot of MVA cases as well, because there it's very the environment is very different, and you can just walking on the road you can get hit down by a tuk-tuk. You know, so I had a patient yang dapat just depan hospital, dia keluar hospital, fine walking, lepas tu dia kena langgar, dia dapat 4 tulang fracture. So it was all closed fractures thankfully. So dia mengalami pendarahan, internal bleeding banyak lah, but mostly in the extremities. But it was interesting yang dia bila dia masuk ke hospital, she was conscious. And she deteriorated so fast, but we managed to stabilize her, giving her fluids lah, all of the resusc protocols, and she survived. So we had to transfer her. I had to transfer her to a different hospital, forward hospital. So along the way, that 4 fractures became 5 fractures. How? It was in the tuk-tuk lah. It's in the ambulance. It was in the ambulance. The roads were so bad. And there's satu hump kat situ, and one of the monitors fell on the patient. So but yeah, she was okay. She survived. But I'm just grateful lah, negara kita punya jalan and our infrastructure, our.
Walaupun ada banyak lekuk tapi tak seteruk tu.
Tak seteruk tu. Okay.
Yeah. Looking into lagi satu segmen saya lihat, pengalaman sebagai doktor Medan, doktor dalam ATM, ramai orang fikir hanya it's all about peluru, pergi perang, pergi mission dan sebagainya. Tetapi ramai juga pasukan-pasukan ketenteraan ni selepas mereka bersara, they face a lot of trauma. Satu, emosi, mental trauma, sebab mereka dah biasa dengan senjata, tembakan, in gunshot scenarios, that lepas mereka bersara tu ada mengalami isu trauma. Betul ke tak?
Betul, ada sebahagian daripada tu. That is satu faktor. Another factor is adjustment. So this is also another issue yang besar. Okay, di mana dalam dunia ketenteraan ni, you have your men around you. That's it. Okay, that is the world. Tak tahu dunia luar. Okay, but in order for you to go to the outside world, you kena adjust back into that environment. Okay, but ada banyak inisiatif yang baik. Okay, for example, perkhidmat. Okay, di mana di sana the servicemen akan dilatih. Okay, and diberi pendidikan extra curriculum. Okay, macam mana nak adjust into the outside world. So this is a very good initiative yang saya lihat.
Benda ni baru ataupun dah lama?
Actually dah lama. But it's a good step forward. Namun masih ada segolongan yang tidak dapat mengawal the mental component of things. Yes, we learn skills. Yes, we learn how to adjust. Tetapi dalam kita punya minda ni, otak ni, there's a lot of other memories, emotions linked to it, traumas. So ada banyak aspek lain di sana lah, where sometimes bila mereka dah keluar, they start experiencing these adjustment disorders, depression, and overall kita nampak health wise also will deteriorate. Because the mind is the one that controls everything.
Bagi saya macam orang tentera ni dia sangat fit. Masa mereka dalam, even kalau yang bersara awal mungkin dalam awal 40-an, mungkin dia berapa 20 tahun lah. So then dia besar rawat. Masa tu dia ada banyak regimen. Bangun pagi, ada
Correct.
fitness, stamina,
Betul.
lari, jogging, and then sometimes weapon training, combat training, semua
Yes,
pun ada.
yes.
You have to go through it. And then lepas mereka besar, tiba-tiba nothing. Dia macam
Exactly.
almost macam retired professional
Yes.
football player. Tiba-tiba semua fit.
Correct.
And then lepas, boom,
Betul.
the belt burst.
Betul. So when you're in that system, you have all that regime, the trainings, memang you akan ikut, terpaksa, no choice, you have to ikut. Okay, and these things are good. Dia akan membantu for you to actually take care of your body, your health. But once you go out and you let go, this is when all of the other penyakit akan datang lah, right? So it's important to have that consistency and that discipline as well to carry it through.
True.
Yeah, so it's important.
Ada tak macam pasukan tentera ni selepas mereka bersara pun ada macam follow up? I mean, if they're having this kind of
Yes. So the
post service.
betul. So our health system is quite
Bagi saya bagus lah.
efficient. So it's good lah dalam tentera. The healthcare component of things, they see it through and through. So even after you finish, so you still are entitled to treatments at any of the facilities.
Faham. And semasa perjalanan kerjaya doktor dalam ATM, doktor telah ada minat ke dalam satu segmen yang menarik dalam psikologi ataupun hypnotherapy.
Betul.
Okay. Apa yang mendorong you kepada hypnotherapy ni? Because bagi saya itu satu segmen kesihatan ataupun medical segment that is old tapi very new to modern medicine.
Betul. So hypnotherapy ni is actually satu jenis adjunct treatment. So it's not a mainline treatment.
Okay.
Tapi apa yang mendorong saya ke arah this field is dalam my service, I had the opportunity to work with multiple groups of people yang very fit, very mission oriented, high risk missions, elite athletes, children, adults, elderly. So there was various groups of people that we had to work with closely at any one point of time. So I noticed certain trends in their minds, in their thinking. And hypnosis is something bukan satu benda yang baru. Okay, it's something that happens dalam kita punya daily life. Cuma how we apply it is in medicine is to actually help to calm the patient down. So that is the essence of hypnosis, is to bringing them into an altered state of consciousness. Maksudnya mereka dalam keadaan yang lebih relaxed, tenang, okay, and focused on something. Okay, so when we put this together and we do medical hypnosis for them, they become very much more relaxed. And we get to help them in behavioral changes, sakit-sakit, chronic pains especially, sangat bagus. So a variety of things we can use it for. So I really got the opportunity to study the minds of these people during that time. And masa saya di medical school, kita belajar mengenai otak, right?
Betul.
But I tak dapat the jawapan yang saya nak. Okay, so I did not get that. So saya pun like, there's more to this, the functioning. Macam mana? So I always ask questions, right? So which led me into bidang neuroscience and also hypnosis. So hypnosis gave me a very nice understanding, very good explanation. Bila saya cuba, because saya pun jenis analytical, so it did not work for me at first. Because saya sangat skeptical, betul ke ni? It did not work for me. But bila saya belajar about intonation, cara nak cakap slow, and and when you apply it onto the patient, you can nampak the difference. Okay, so it's basically in a different state of consciousness. Okay, so it's not like saya boleh tell you, Dr. Roland, you act like a chicken.
Pakai jam
Tak boleh. So those kind of things are old techniques. It is possible. Okay, cuma in medical hypnosis, it's a very safe process yang kita buat. Okay, to get somebody into a very relaxed and state. Okay, so when they are di dalam this unconscious state, we call it, minda kita ni lebih open to suggestions. So these suggestions ataupun these cadangan, okay, datang daripada pesakit, bukan daripada kita.
Okay.
Okay, so apa mereka nak. Okay, so we will establish all of this way before the
process of the
before
hypnotherapy.
the session itself. So I kena betul-betul faham what is it that you really want to change about your lifestyle, about your perspective for some behaviors and all that. So kena betul-betul faham, and then we work during hypnosis based on what they want, not what I want.
Understand.
Yeah.
So bila doktor ceritakan tentang hypnotherapy, seperti katakan this is bukan macam kau boleh jadi kucing ke pakai jam ke macam tu, and then terus you akan tidur 1, 2, 3 pump tidur macam tu, bukan. Itu pun apa yang saya faham, the mind ataupun minda kita. I think sekarang kita dah boleh kasihkan otak tu satu, mind tu satu.
Betul.
It's two separate
Correct
things being in one place.
Yep.
And the hypnotherapy is much more, kita fokus pada much more of the mind therapy rather than the functional like neurological science. And apa yang saya setuju sangat is, masa kita belajar perubatan, bila datang pada subjek neurology ni macam so complex, like we leave it to the neurologist lah. Apa-apa pun kita refer je. Tetapi sekarang ni bila kita lihat kepada hypnotherapy, psychology, there's something yang macam kita masih tengah explore.
Yes.
There's more to be explored with all of this. Macam mana kita menggunakan the suggestions, macam apa, cadangan untuk patient, and how to go into certain wave of the mind. So how long this journey is? Adakah patient yang menjalani hypnotherapy ni dia boleh berada dalam situation dia alert dengan cadangan tu, ataupun memang dia akan technically dengan simple layman tu dia akan ditidurkan?
Okay, so apa yang berlaku semasa hypnotherapy ialah bahagian otak kita di depan adalah prefrontal cortex, and bahagian dalam tu di midbrain, two of the main parts yang akan communicate during hypnosis. So during hypnosis, bila kita induce a state of trance, mereka akan rasa tenang, yes, but they are alert to our suggestions.
Okay.
Right? So bila seorang ni mengalami tekanan emosi yang tinggi, for example, anxiety, stress and all that, the inner parts of the brain, nama dia limbic system, dia akan lebih aktif. Right, so dia akan hijack this part of the brain that's called the amygdala. So dia akan macam hijack di fungsi prefrontal cortex. So the prefrontal cortex ni sebenarnya yang menjadikan kita manusia. So bila di prefrontal cortex dia lose control, lose command, okay, dia tak ada authority ke atas di limbic system anymore. Okay, so we'll help them to regain this function. Okay, this authority. Dia macam general or a commander who loses command over his men, right? So if you give him the right tools, and you streamline the communication protocols, and you motivate the men again, okay, things will get better. Okay, so there is hope for change, and the more kita practice, the better we get at it. So hypnotherapy really allows them to take more control over their mind lah. Mungkin sekali tidak cukup, okay, but generally dalam 6 ke 8 sesi
akan nampak banyak perubahan.
Yes, tetapi sometimes for people with chronic pain, okay, satu sesi pun sudah memandai. Okay, it's very interesting how the
pain management with hypnotherapy.
Yes, correct. So this is a very interesting field, and saya pun sangat teruja, and I've been helping a lot of people through this mechanism. So yang mana pesakit yang datang dah try first PCM, second line, they've tried all the NSAIDs, Acoxia pun,
injection,
but still the pain doesn't resolve. Patients with fibromyalgia, rheumatoid arthritis, So when they come for these kind of therapies, it kind of settles the mind a little bit, gives them more control. And it's interesting that otak kita ni, dia punya pain center, pusat untuk pain ni, dulu kita belajar satu tempat je, di thalamus. But sebenarnya it's many more.
Okay,
So dia a variety of places. And bila kita cakap pasal pain ataupun sakit ni, dia it's often associated with emotions.
okay.
When the pain is associated with emotions, this is when it gets out of hand.
I call it like an entanglement lah.
Correct, it's an entanglement, right? So there are ways that we can diminish or reduce the intensity of this pain, distract the pain. Okay, the pain will still be there. Probably the root, we're talking about chronic pains lah, bukan sakit yang baru timbul. We're talking about pains
Perpanjangan
berlarutan. Okay, so this kind of pain. So dia effective dalam managing this type of patients.
Understand. And bila doktor merujuk kepada like macam sakit yang fizikal kan, macam MS, multiple sclerosis, rheumatoid arthritis dan sebagainya, those are like very physical, like much more of like a motor neuronic kind
Correct.
of direction. How about sakit-sakit yang datang disebabkan oleh emosi or emotional trauma, now distracting the emotion because of mungkin ada loss, mungkin phantom limb situation in like army, they are just like perpetually going back to the scene where there was like gunshot wound or this kind of hypnotherapy also help.
Yeah, so otak kita ni macam black box lah. Okay, so they say that it records ever since you were conceived.
It's like the Matrix.
Yeah, so bila kita dalam kandungan pun kita our nervous system is starting to develop, and it's already starting to record whatever that it can whenever it's able to. So apa segala jenis peristiwa yang berlaku dalam hidup kita ni is stored in our mind. Okay, especially the ones which have emotional attachment to it. Okay, so these memories
highlighted lah.
Correct. So it is possible that we can go back into that point of time and retrieve those memories and probably neutralize those emotions and then bring it back. So we got to desensitize them accordingly. Okay. Memang dia tak mudah because we're talking about the mind is just satu macam lautan lah. It's so vast. Kita tak tahu mana nak start, but we have certain techniques and how do we get them to get to where
so
they
kalau
want to
lepas seorang yang melalui proses macam hypnotherapy ataupun the whole therapy, do they have homework tak?
Yes.
Ada macam kerja rumah kena buat?
Ada. So memang kita akan bagi kerja rumah kepada mereka, and to be honest with you, 80% saja yang buat kerja rumah tu. Okay, and in those people kita nampak memang ada perubahan yang besar. Okay.
Dia committed lah untuk
They're committed to change. They want it. Okay, because they have a goal now. They have established a goal. We've worked together. Kita tahu which is the direction we want to work, and then they are motivated to move forward. Tapi kita tak nak motivation sahaja. We want it to be something that is consistent. So what is interesting dalam hypnosis is because kita banyak berinteraksi dengan the subconscious or the unconscious mind, these changes that yang akan take place is more lasting. Contohnya CBT kan, dalam cognitive behavioral therapy, kita deliver the therapy in a beta state. So kita conscious macam ni. Okay, so mungkin apa yang akan absorb just maybe 10%, 20%. Some people, the analytical ones, maybe it works for them. Okay, I'm not saying that hypnotherapy works for everyone. So there's varieties of modalities, therapies that are available. Okay, that can be suited to you. But most importantly, pesakit kena tahu atau kena ada that will untuk perubahan, untuk that change, to take that first step.
Faham.
Okay, that's the most important thing.
Doktor cari cerita pasal wave kan. Berapa wave ada dalam otak kita?
Okay, so the like currently like how we are sitting and talking macam ni sekarang. So this is called the beta. Usually our beta waves are much more prominent, much more active in this state. When we're doing contohnya matematik ke, we're doing something that is very perlukan kita punya cognitive thinking kan. So that one you can see the gamma waves are higher. In hypnosis, we will see alpha waves are higher.
Okay.
Alpha and theta. Sometimes alpha is when you're deeply relaxed and you're focused on something. Creativity also comes here along
Alpha wave.
in alpha. Theta also. So theta is like deeper meditative states.
So kalau dalam waktu tidur tu ialah theta.
No, not necessarily. But you see the delta waves are higher there.
Delta waves.
The
So tengok ada 4 lah. Major ones you're looking at.
5.
5.
Yeah.
Okay.
Okay. So
Yang kelima ialah apa? So, ada alpha,
so there's alpha, there's beta, gamma,
theta,
delta.
delta. Okay.
Right. So these waves have different functions. And macam mana kita tahu yang hypnosis is not just cakap. Okay, so in my therapy, I actually use EEG monitoring.
Oh, okay.
Yes.
So kena pakaikan macam
So my EEG yang kita pakai is a bit more sleek, a bit more relaxed. Patient pun rasa selesa dengan tu.
bukan macam Professor X.
Bukan. Dah. We've already passed that stage. So it's something simple, wearable, mereka boleh pakai, and during the therapy I can actually monitor what state are they in.
Okay. So it will just immediately you can see the pattern.
Correct.
Okay.
Okay, so I can see the pattern, and maybe I might need to change the way I deliver the therapy. I can tell them to relax a little bit more breathing, focus on the breathing. If I notice the heart rate is going up, so my therapy is it's backed with something tangible here, so I can see the data.
Wow, that's interesting. So sekarang ni mana doktor praktis sekarang ni? Menjalankan pengamalan di hipnoterapi di mana sekarang?
Okay, so my center is in Chan Saulin, Sungai Besi. So it's therapy center. I call it the Mind Development Center. Okay, something positive. It's not only untuk orang yang ada problem. So I see a very, very big group of people yang di mana like they're already good high achievers already, but they just want a bit more and they want that calmness.
Okay.
So
ada juga orang yang tak ada masalah trauma, tak ada masalah like issues macam emosi dan sebagainya. Boleh juga menggunakan teknik ni untuk meningkatkan their brain ability.
Betul. So now I think past 2 years saya banyak bekerja dengan elite athletes. So these elite athletes, some of them have they are good achievers. Mereka dah buat yang terbaik dalam mereka punya latihan, and kita nampak bila latihan tu memang very good, but when it comes to competition, tak boleh. Why? Right? So there's a mental block here. So this mental block is something very, very serious, and it needs to be addressed because they are capable of way more. Tapi bila dah sampai dekat track or lita, they cannot perform. Why? So I work with them and try to find the solution and get them into this flow state. Okay. So we will practice and we'll induce this flow state when they're not on the track, right? So when the mind and the body is already adapted to this state, to this flow state or trance state, when they are in the field, mereka boleh fire one trigger, and they are back into the flow state. So this is something interesting that I've been working with, and ada banyak success stories juga lah. I cannot name people, but it's amazing to see how they turn their lives around lah.
And they can perform.
They can perform, and daripada become always like number 3, number 4, or even not winning anything to winning championships. So this is really
good. I think kebanyakan teknik yang apa Dr. Amit katakan tadi, memang boleh diguna pakai oleh kebanyakan individu-individu biasa.
Betul.
Sama ada dalam penjagaan ke ataupun personal life, relationship and everything, they can actually turnkey this
Betul,
trigger.
betul.
If they tahu apa dia punya push point,
Betul.
they can use that
That's
the
right.
ability of the brain
That's
to
right.
go into that
Betul,
flow
betul.
state. Okay, sangat-sangat menarik. So, any last messages for audience di luar sana? Mungkin yang bukan kata skeptical, bagi saya hypnotherapy ni memang dah lama wujud dalam perubatan ataupun terapi, tetapi di Malaysia masih di peringkat awal, because kebanyakan orang bila dikatakan macam mind, dia akan fikirkan, oh, do I go and see a psychologist or I'm going to see a psychiatrist? And bila dia pergi pada dua mazhab tu, the second thing, the thing is, am I going to be labeled as saya ni nyanyuk, saya ni gila, saya ni ada depresi? So they a lot of negative words in that direction, and then they're going to say, oh, am I going to be put on some psychiatric drug? So bukan bermakna macam kalau anda pergi dapatkan rawatan to them, anda akan dilabel, bukan. Tetapi some therapists mungkin perlukan rawatan bentuk demensi sedemikian, and on your side pun ada kepentingan dia. How do you see this? How the future of medicine is going to interact, especially when it comes to like mind therapy?
I think the most important thing orang kena faham ialah kita punya health ni dia bukan satu bahagian sahajalah. Okay, there's many contributing factors. Okay, kalau kita nampak this biopsychosocial model of health, right? Dia banyak bahagian, biology satu, psychology satu, social satu. So all of these components, bila dia dalam keadaan harmoni, baru dia akan it can push to vitality and longevity and so on, mental well-being. So my message to people is, do not neglect mental health and brain health. Semalam I was with Monash University, di majlis dirasmikan oleh Puan Nori Abdullah, right? So the focus was a lot on dementia. So we talk about dementia, it's startling to see the rate of people developing dementia, okay, in the world, in Malaysia as well. Southeast Asia yang paling tinggi actually in the world.
Wow.
Dementia. Dementia ni adalah satu condition di mana we lose our ingatan, cognitive ability semua. Okay, so there's many other components bawah dementia, but dementia is just the umbrella term. Alzheimer's, Lewy body disease and so on. So this is a big problem, right? But what is the contributing factor to this dementia, right? Mental health. Mental health, growing up even from childhood, can leave marks and can cause dementia. So this is a very interesting concept right now, and when we work towards this, we want to prevent dementia. We don't want to lose our loved ones, or even ourselves. It's very, very important to pay attention. How are we not going to end up in that state, or at least do our best? How? Paying attention to mental and brain health. So bila kita cakap pasal mental health, there is no need to stigmatize it. Dah tak payah dah. It's something real, okay? But when we talk about mental health, we don't necessarily need to talk about anxiety, depression, and so on. Okay, banyak cara lain. Okay, we think about how can we elevate our minds, how can we elevate our lives, how can we elevate our friends, our society, So it starts from within actually. So mental health tidak semestinya satu benda yang is something negative, no. Okay, whatever that's in our mind, right, can reflect outwards also, and it can affect a very big group of people as well. So the change has to start from within. So accept that mental health ni adalah satu kepentingan, okay? And how are you going to address mental health is, you need to understand it first. You need to understand your mind, build your mental resilience, and also know when to seek advice and help. because there's a lot of model providers dekat sana yang menawarkan mental health services. So it's important to cari seorang provider, okay, either doktor ke licensed mental health personnel yang boleh give you that closure, comfort, unbiased, neutral, and 100% confidential.
Betul.
So this is my
Itu sangat penting.
policy. Okay, when you can find this, right? Like even in my practice, my therapist tidak akan share stories about other patients. We will never mention names. So it's strictly confidential.
So, Dr. Amit, where can we find you online?
Okay, so you can find me on Instagram, Dr Amit J Logan, or my website, loganmarks.co. So loganmarks.co.
Okay, terima kasih Dr. Amit kerana sudi datang ke Lesung Batu Medic Show hari ni. So apa yang message yang mungkin saya nak sharekan is, I think sebanyak mana kita lihat pada kesihatan fizikal, kesihatan minda pun sangat-sangat penting. The mental health, the brain function, kesihatan otak, salah satu benda yang kita tak boleh pandang enteng langsung, because kita kena faham kesinambungan minda dengan badan ialah satu. So kita kena jadi komando juga dalam bab ni. Physical strength pun penting, mental strength pun sangat penting dalam situasi mengharungi dunia dengan masa-masa yang cukup genting ni. So sekian saja episod Lesung Batu Medic Show kali ini. Sehingga kita bertemu di episod yang akan datang, jangan lupa like, subscribe Lesung Batu Medic Show di halaman TikTok, Facebook, Instagram dan juga YouTube. Sehingga kita bertemu, kita lesung kau-kau.